And welcome back. Some women are reporting getting pregnant while using weight loss medications. The term Ozempic baby is trending on social media. So we're breaking down the facts and discuss this more. We're joined by Dr. Nita Bijoor. She's a triple board certified family physician at Oakview Medical Associates in Greenville. So thank you so much for joining us today.
You're welcome.
And I think this is an interesting topic. I know a lot of this is just anecdotally right now. So tell me what you've seen even with your own patients, because I understand you've seen this with your patients too.
Yes, so I have a special interest in pre-pregnancy planning. And so what I've seen is with weight loss, it actually, medications like the semaglutide, the GLP-1 agonist medications, they actually can cause fat loss. And hormones are sluggish in fat tissue. So when you promote fat loss, the hormones become more active and more efficient. And that's what we want in pregnancy, right? So indirectly, we have seen when we help patients lose weight that they actually get healthier, and that causes healthier ovulation, healthier menstrual cycles, and they can conceive. So that's something, it's a double-edged sword. If they don't want to conceive, we have to make sure that we plan and we protect them. And if they want to conceive, then we need to know, approximately in how many months, and then we plan for the weight loss, so that helps them have a healthy outcome in pregnancy and delivery.
So it's not that the medication itself necessarily increases fertility, but it's the weight loss that you end up having from the medication.
Yes, I think that's what we're understanding now. And there are other medications that help with that too. But this class being so popular now, people are noticing that, oh, I took this for a few months and then here I got pregnant. So if it's a wanted thing, it's a great thing to really talk to your physician and plan for it well, pre-pregnancy counseling. We're also seeing, people think that it may be related to or have an effect on birth control pills. So, but we've not seen any direct evidence of that. What we're seeing is because of the weight loss, it can make your hormones more efficient, and then birth control, it can affect absorption of birth control pills. The other thing we're seeing is because Ozempic can cause nausea and vomiting, that could reduce the absorption of the pills, and maybe that affects it. But this is all, like you said, anecdotal, what we're seeing in clinical practice.
So what's your recommendation if you want to lose weight but you don't want to get pregnant?
Well, then it's really important to plan and protect, right? Because of the long half-life of these meds, they're once-a-week shots. So what happens is they can stick around in your system because of the long half-life. So if you're planning to get pregnant, then you want to stop these medications at least 8 to 12 weeks before you intend to conceive, just so that it's safely out of your system and safe for you and the baby. In animal studies, there have been some really bad effects on the fetus, but there have been limited human data studies, so we really don't have that to go by. It's just better to practice safety.
And you should stop taking the medication once you get pregnant, right?
Yes, absolutely. Because we don't have that, we don't know the knowledge what it would do. So it's best to, if you find out that you're pregnant and you have been taking these, immediately contact your family physician or your primary care physician, your OBGYN, and make sure you stop these medications. There are healthy ways to manage good weight in pregnancy. Of course, getting on all your prenatal vitamins, taking your folic acid. So it's more than just stopping a medication and thinking the pregnancy is just going to progress along. It's really important to make sure that you understand the management throughout, because these meds are actually anti-diabetic meds originally, right? So we still want to focus on good glucose control throughout pregnancy as well.
I know that can be an issue. So.
Yes.
All right, well, thank you for informing us about that. I think it's a topic that we've heard about, but we're really learning about, and we need to have some more research on it.
It's very important. I've had some happy success stories from patients that have conceived and we stopped the medication and they've done really well. So we want safeties first. So
good to know.
Yeah.
All right, Tori.
Always interesting. Thank you.